Hi, my name is Bronwyn Fitz. I'm an integrative gynecologist and functional medicine doctor, and today I'm going to give a little bit of an overview on perimenopause. I see a lot of women in my practice who come to me because they're in their kind of late 40s, maybe early 50s, and sometimes earlier, and they're starting to have changes in their menstrual cycles. And it can be very disconcerting to have this happen after you've been going along year after year with your body behaving a certain way. And a lot of times women start feeling, so what are the symptoms? For some women, it's heavier periods, irregular periods, sometimes more pain. A lot of times, mood changes that a woman's not experienced before, more irritability, sometimes sleep disturbances. Um, and some of the more advanced symptoms, rather, of perimenopause then turn into brain fog, vaginal dryness, hot flashes, things like that. And you can experience all of these symptoms even before your periods stop coming. So I wanted to backtrack for just a second and talk about like, what's going on, physiologically, what's happening. So, just very briefly, in a normal menstrual period, if you have an ovulatory cycle, the first half of the menstrual cycle, you have a fair amount of estrogen being, made by your body. And then with ovulation, your body then makes progesterone. So the second half of the cycle, there's the estrogen levels drop and the progesterone is the more dominant hormone. So as we approach the end of our reproductive lives, meaning all of the eggs in our ovaries have been spent, we are not having very reliable ovulation events. And so what that means is that that nice surge of progesterone that your body has been experiencing all along isn't coming. So the cycles become more estrogen dominant compared to progesterone. So that's where we get that phrase estrogen dominance, or one of the ways. And as an integrative gynecologist, I use that phrase with patients. A lot of traditional doctors don't use that phrase estrogen dominance, but I like it actually because I feel like it explains to people in a way what's happening with their body. So again, just to repeat, you're at the in perimenopause, you're not necessarily having good ovulatory events with each cycle. So you're not having as much progesterone being made in the second half of your cycle. So you're estrogen dominant. And so a lot of these symptoms that I was just explaining, we do associate with that estrogen. So the lack of progesterone is really one of the first things we notice as we approach menopause. So how do I support women as they go through this phase? Because it's a normal phase, right? So, reassuring women that what they're experiencing is in fact normal is the first thing that I do. But there are so many ways. Okay, so food is medicine. This is one of the things that I always come back to in my practice. So foods that are supportive are things like flax seeds, whole soy like edamame, tofu, the fermented soy products, tempeh, and things like that are great too. If you tolerate soy, so there's a caveat, not everyone can tolerate soy. Green tea is another really beneficial food to add into your diet at this point in your life. And then we talk about exercise and the importance of balancing the real sort of energetic, adrenaline producing exercise with the calming exercises, things like yoga, the calming yoga and Tai Chi. I talk about stress management, which is huge in helping to balance the estrogen and progesterone, and certainly as we get into the period where you're having hot flashes, stress management is really important. And so that comes down to things like mind-body practices, meditation, breathing exercises, even just allowing yourself to do the things that are nourishing to you and allow you to your brain to really disengage from all of the sort of the work of your daily life. You sort of need to give your body and your brain a break a little bit. And then I'm an herbalist. I've done training in herbal medicine. So some of the herbs that I think about for women in perimenopause are things like chaste tree to support progesterone, rhubarb, soy. Again, soy comes up, kudzu, and then in terms of some of the herbs to support mood are ashwagandha, St. John's wort. There's a whole host of them, and I really kind of tailor the herbs that I choose to each woman based on kind of what else is going on with her. We focus on estrogen elimination also, okay, right? So this is an estrogen dominant phase. So I want to really educate women on how they might be exposing themselves to endocrine disruptors through their environment, through pesticides, through plastics, through chemicals they put on their skin. We look at estrogen metabolism if we can in the urine, and we use food and supplements to help influence how we metabolize estrogen and excrete it. So we talk about, if appropriate, we talk about magnesium and DIM, things like sulforaphane, the cruciferous vegetables in general, just eating lots of cruciferous vegetables, things like cabbage, broccoli, cauliflower, kale. There's a whole family of them. We need to make sure women are eliminating, so literally going to the bathroom, and if constipation is an issue, we have to address that. So we get people having regular bowel movements. Sometimes we add things like calcium D-glucarate to help keep the spent estrogens in the stool. So we really focus on estrogen metabolism quite a bit. And then for some women, we give bioidentical hormones to help support them. So the first hormone I think about adding back is progesterone, because that's the first thing that drops. So sometimes you can just add a bioidentical progesterone a few days out of the month to kind of mimic, what your body was doing before, just to get you through this kind of phase. Eventually your estrogen levels will drop as well, and people notice more estrogen depletion kind of symptoms, and so that's more of the vaginal dryness and brain fog and hot flashes. And so, at some point, some people like to add in estrogen too, and then we have the whole discussion about hormone replacement therapy in the newly menopausal woman, and that's a whole discussion. And for some women, going on hormones is a very good thing to do and something that they are interested in. Other women aren't interested in hormones or have medical reasons why really maybe we need to avoid hormones, and then we go further down the path of the non-medical approaches to menopause. But that's about it. I just wanted to give a quick primer on perimenopause. So if you're interested in learning more about my practice, please give me a call, 203-900-4194, or check out my website, women'sintegrativehealth.com, and I hope you have a great day.